Ultimately, in my world, the built environment world, there's often only so many levers you can pull actually within a home or an office to actually have an outcome. And similarly, I really like what you were saying about policy, that sometimes, like, the reality is that the world is moving so fast, we're just not going to know. We can't let perfection be the enemy of the good. Yet at a policy level, we can implement things that can have an outcome.
Well, I think, from a regulatory point of view, people have got to try and understand where the issues are so that they can see that if a regulatory factor is introduced, whether it's low emission zones or whatever it happens to be, and it affects them as people, then they've got to understand, they've got to weigh up in their own minds. Well, why is this affecting me? What effect is it having, And of course, this is part of the problem with air pollution. And it's really a reason why I'm still involved in it after 50 odd years of research into asthma and related diseases, is that the public's broader understanding of why air pollution is a problem and why we have to regulate it in the way we're doing is not really good enough at the moment. So everybody, I think, is aware that air pollution is a problem, and there's been enough publicity around all of that over time to raise awareness. But I think the big issue is awareness about what and why. And I think this is why we have the pushbacks over the low emission zones, for example, or the ultra low emission zone in London, is that it inconvenienced people and caused them concern because their lifestyles are having to change, and they wouldn't fully appreciate the reason why. But also then, there was the possibility that in the case of traffic diversion, that there are others then that were going to be exposed to all this traffic that previously weren't exposed. So I think, fixing some of these problems can have unintended consequences. Interestingly, though, with the ultra low emission zone in London, we're beginning to get some really interesting health statistics now, as opposed to just measuring what levels of pollution are, which is what the Mayor of London has been following, which had been falling, which is great. But no, in addition to that, we're now looking at hospital admissions, emergency admissions, and also episodes of bronchial asthma. And even going further back than that, the way the lung grows over time, because one of the effects of air pollution on the developing baby in the uterus in the pregnant mother is that it impairs the development of organs like the lung. And of course, if babies are born with small lungs, then they aren't able to cope with other environmental issues as well as air pollution. So, evidence now is emerging for some of these interventions, like the ultra-low emission zone, that this actually is, these are positive health effects. So all of this takes time, Simon, and unfortunately, it's not like just switching off a light bulb, really. When you make an intervention, it takes several years usually before you know that intervention is actually doing what it said on the tin and affecting the public health. And I think when people realize that it is affecting public health and that their children are going to be fitter as a result of it, then we start to get a reasonably balanced argument going.